Welcome to Waitakere Hospital. If you're watching this, you're probably a paediatric registrar about to start your run here. I'm just going to take you through a typical day of a life of a paediatric registrar. When you enter Waitakere Hospital, always remember to wash your hands. So before handover starts, you can pick up your scrubs from this room here. So every day starts in the handover room over here. I'll show you inside. So typically the night registrar brings all the phones and all the pages and the handover lists of the ward and SCBU to the handover. We run through the ward patients, the SCBU patients, the emergency department patients, and any expected patients that may arrive.
Hi everyone, I'm Jutta Wendenböhm. I'm a paediatrician here at Waitakere Hospital and I'm the clinical lead for SCBU. This is just to introduce you to the special care baby units. First of all, when you come to SCBU, you need to wash your hands. You have to remove your jewellery, bare below the elbows, either wash your hands or use the gel to wash your hands. When you come to SCBU, it might be a good idea to orientate yourself with the layout of the unit, but also to go to theatre and to the maternity wards to see where the resuscitators are and familiarise yourself with the equipment. If you go to resuscitations, we've got a resuscitator on the unit, and the layout of the resuscitation trolley is all the same at all locations. You should take the resuscitation bag. You just go across to the incubator, which we can take to theatre, and this is our red bag we take to resuscitations and births. Familiarise yourself again with the content of the bag. We do have a model of credentialed nurses who are the first call for deliveries and births, but you might get called if there's no credentialed nurse rostered. And if you haven't been to a lot of births, you could go with the credentialed nurse to get some more experience. The next thing we find really important is documentation. So we write daily notes, admission notes. There's a template on the computer that you can use that prints out on clinical paper. Find somebody to show you how that works. Also take time to chart medications. We recommend not charting medications on the ward round, but find a quiet space to do that, because then less errors will occur. The neonatal database on the computer gives you an overview about the patients on the unit and needs to be updated on a daily basis. And also find somebody to show you how that works. The next step that would be important is if you do postnatal reviews on the maternity ward, document that you've done it, and any patient under paediatric care needs either an electronic discharge summary or a paediatric note. Okay, that's so much from me. Enjoy your stay in SCBU.
To attend certain deliveries that the midwives are concerned about, and we work very closely together with the midwives. If an infant needs resuscitation, then you've got the resuscitator over here, but if the infant is well and doesn't need your input, we strongly value the importance of skin to skin in this hospital. If you get called to deliveries in theatre, go through this door to pick up a surgical hat, but if you're in a rush, use the double doors down the line.
Hi, I'm Carmen. I'm the Paediatric Nurse Educator for the Emergency Department here at Waitakere and at North Shore Hospital. I'd like to welcome you first. Waitakere is a shared ED with both adult and paediatric patients. Our doctors and nurses are all trained to work across both areas. However, we do have specific nurses and doctors who only work in the paediatric area. We have two paediatricians, Stefan and Olwen, on our staff. We have clinical nurse specialists who work in paediatrics only, and we have one nurse practitioner. The paediatric area is staffed with 3 nurses at any one time, and one of them is a specific Paeds link nurse, which means they predominantly work in the paediatric area, giving them more skills. We have 1 paediatric resus room.
This is one of the paediatric resuscitation rooms. I'm sure you're going to be very familiar with this area when you start here. Just remember to familiarise yourself with the algorithms on the wall here. There's an infant resuscitator for young babies and a bed for slightly older children.
And we have 2 adult resus rooms. One of those adult resus rooms can double as a paediatric as well. I guess it's important to know we're a small ED and we don't have an intensive care unit here at Waitakere Hospital.
There's no HDU or ICU for paediatrics or adults in Waitakere Hospital.
So we like to identify those children that might need retrieval from PICU quite early, and it gives us time to arrange a team to come across to retrieve these children and take them to Starship. We have at any one shift 2 emergency consultants. We have registrars and we have house officers as well. And we have one of these registrars who is dedicated to work just in the paediatric area for that shift. This is a new concept, so it's been good to try and get children fast-tracked that could be seen quickly and sent home.
This is the brand new emergency department. You'll get calls from GPs and other hospitals for patients that they want you to see here. We see kids from all over the Waitemata District Health Board, and we work closely together with the emergency physicians as well.
To our unit, and I hope you enjoy our attachment in general paediatrics. It's a really good opportunity here at Waitemata to get exposed to the full amount of general paediatrics training that you can have. Really take referrals from GPs and also see referrals from the emergency department team. Our expectation is that GPs will ring us to discuss the cases, and we have a mechanism for recording that which will be shown. With that in mind though, we tend to try to see kids as per their clinical need. So our expectation is that all members of our team, consultants and registrars included, will see the most sick kids in the department, even if they're technically under the emergency department. And we try really hard to work closely with our ED colleagues to make sure that the kids are seen in a timely manner and get the most appropriate care. We also receive kids that have been seen in Starship Emergency Department for admission on our rangatira ward. Those kids, we try to avoid them sitting around in the emergency department for too long. So if everything is in order and they don't look too unwell and haven't deteriorated on transport, they should be sent straight down to rangatira and the admission formalities can take place on the ward.
We have clinical nurse specialists who work in paediatrics only, and we have 1 nurse practitioner. The paediatric area is staffed with 3 nurses at any one time, and one of them is a specific Paeds link nurse, which means they predominantly work in the paediatric area, giving them more skills. We have 1 paediatric resus room and we have 2 adult resus rooms. One of those adult resus rooms can double as a paediatric as well. I guess it's important to know we're a small ED and we don't have an intensive care unit here at Waitakere Hospital, so we like to identify those children that might need retrieval from PICU quite early, and it gives us time to arrange a team to come across to retrieve these children and take them to Starship. We have at any one shift 2 emergency consultants. We have registrars and we have house officers as well. And we have one of these registrars who is dedicated to work just in the paediatric area for that shift. This is a new concept, so it's been good to try and get children fast-tracked that could be seen quickly and sent home. We have education opportunities available here in ED. Every Thursday we have a paediatric scenario, and then the following Thursday it's an adult scenario, and you're more than welcome to come along and see those in action. We also have regular in-service specifically for paediatric presentations to try and keep people up to date with new equipment and new trends and research. We do not have an observation short stay here in ED, so patients that need to stay for longer than the 6-hour target need to be moved up to the ward, where they can either be placed in short stay or long stay.
It's Christmas here on Rangatira Ward, and typically for ward rounds, we put our names up on the whiteboard there, and then grab the notes and see the patients. See who can be discharged, see who needs to stay in for another day. And then we work together as a team, alongside the nurses and the allied health staff, to improve patient care.
Hi, I'm Sarah Timmis. I'm the charge nurse of Rangatira Ward. Welcome. We're really looking forward to having you here. I was trying to think about some special tips to give you. Probably the biggest one I would say is that as a team we work really closely with our doctors. We've got some really good characters here who you'll love to work alongside, and they really love that you bring them along for the ride, so to speak. Involve us in what you're doing, involve us with your thinking, and we can support you all the way. Probably big tips would be, for me, when I'm looking at notes or reviewing things and doing reviews, is making sure you're signing legibly and clearly, and that we can read your plans. That's really fantastic, because actually it goes a really long way. I'd also ask really kindly that when you're accepting admissions from elsewhere, you need to let us know. So that would be the person that's in charge, the coordinator, or me if I'm around. Just let us know that actually there's admission coming in, or you want to admit from Starship or Kids First, so that we know, because sometimes when we're tight for beds, we'll be declining those admissions. I'm trying to think if there's anything else I wanted to say, but to be honest, what I would say is come say hello, come meet me, come say hi, get to know our team, and we'll support you in any way we can to enjoy your time here. Thanks a lot.
And I'm a speech language therapist, and we see children with feeding and communication impairments across several settings at West. There's 3 of us, and our role is primarily to assess feeding and to determine aspiration risk and how to manage that risk as a part of the MDT. On Rangatira Ward, we see children with suspected aspiration, such as kiddies that represent with chest infections or recurrent bronchiolitis, and kiddies with faltering growth due to poor feeding, and you can refer to us from Monday to Friday, and our numbers are on the white chart that's beside the whiteboard. And on SCBU, we see preterm infants with risk factors for feeding difficulties and with identified disability, and those that we know are aspirating. And we assess feeding readiness and provide education to families on how to make feeding successful. And rather than focusing on volumes, we try to focus on a positive experience so that feeding continues in the future. And we're allocated to 2 4-hour shifts, and currently we're working there on a Tuesday and a Thursday. And our numbers are in the Rolodex beside the computer at the front desk, or you can ask the nursing coordinator to refer to us. And in the community, we're part of the child development team, and we see children with complex issues. So for kiddies with communication impairment, those children need to have multiple developmental needs. So usually they're under the visiting neurodevelopmental therapists. And there's a long list of referral inclusions and exclusions for our feeding criteria as well, and that is under the control documents for Community SLT Referral Guide 0 to 16 years. And you can fax those referrals through to 6877. And we also run a 12-week feeding group with our MDT to help children around tube weaning and to increase the variety of foods that they're having in their diet. And those kids need to meet criteria for the child development team in order to attend. And my advice for new registrars is when you go in to assess, it's really helpful to ask families about what's happening with feeding. So rather than saying, how's feeding going? Because you usually get, oh, it's good. If you ask them, does your child cough or choke or gag during feeding? Do they refuse feeding? Does it take a long time? Those are really great screening questions so that you know which kiddies actually could really use a referral to us. And I would say remember to smile to everybody, because I think this is one of the friendliest hospitals that you can work at, and yeah, it's a really nice, positive environment, and people will smile back. Thank you.
Hi there, my name's Tiana. I'm the ward play specialist. I'm based on the ward. This is our treatment room. Most of our procedures are done in our treatment room. we aim to do most of our procedures in our treatment room. Look forward to working with you.
Hi, my name's Tony. I'm one of the physiotherapists in Rangatira ward. There's 2 of us full-timers in our team and a few others that are rostered on during the week. Our working hours are 8 until 4:30, and we also have a weekend service where different 10 to 12 people are rostered in on the weekend, coming in within working hours. The physio focus on the ward is respiratory, but we do accept appropriate referrals for mobility or neurological needs. And then on the ward you'll find a printout of appropriate referrals for the respiratory side as a go-to guide for you. And with regard to respiratory conditions, we mostly see productive pneumonias, bronchiectasis, lower respiratory tract infections, and also many complex needs children that are needing extra respiratory support. We have a prioritization tool which we do refer to when on the ward, and this just ensures that all the children who need physio most are seen first. Our phone numbers are on the board in the ward next to the patient lists, and all the times for the physio sessions will be planned out in the morning for you to see on the board as well. Yeah, we're happy to chat if you think an appropriate referral is needed for physio, and you can just catch us on the ward, and we're always in our blue scrubs.
My name is Eva Pali. I'm the administrator and ward clerk for Rangatira Pediatric Inpatient Unit for 12 years. Welcome aboard up here. And then inside in this we'll have all the consultants named, and if there are any things that you need to slot in the consultant, this is their mail slot. Ward review is actually a patient you see in the unit for Skibu or Rangatira. So if you wanted to see this patient, we have a book actually here. This is we got a book here, and we put what you do. You put the name of the child in the book and the day that you want it and the time, and then you let us know that your this is a child that's coming in for that day. But if you see a patient in outpatients and you want to bring this patient back, and that's what we call outpatient review. So we let us know. And the other thing, please do not afraid to ask us if you have any notes or charts that you wanted to order. Ask us and we will do that for you. We'll order them, and then what we do, we put all the charts in here, the one that you order, and then if you just get checking on here if the chart date has, if we received it, and we keep it in there. And notes are here. We have trays here. When you finish with any outpatient notes, you just put it up in this tray and we'll send it back to medical record, and results and labs and things like that will go in these trays. We also have a book here. This is our admission books for Rangatira, and if you wonder if you want to find a child that you wanted to bring it back, or you wanted to do it, this is the book that we keep everyone that comes, every children that comes to the unit. So it's actually here, or after hours will be in the nurse station.
So you'll be assigned some paediatric clinics here at Waitakere. Always remember to arrive about a half an hour early, read about your patients beforehand, and then when you arrive to the clinic, discuss the patients with your consultant. Once you've seen the patients, you discuss them again afterwards, and then you use this bad boy over here to dictate. And then in a matter of weeks, you'll get the letters back to you, and you'll edit them, send them back to the relevant consultant, and then finalise them.
Hi, my name's Sue Thompson. I'm a paediatric nurse, have been for 1,000,000 years. I have the role of triaging all of the referrals that come through to the whole of Waitemata DHB from GPs and other health professionals in the community. I live in Snellgar, second floor. If you just walk down the corridor, you'll find me on the right, just before the admin people. If you've got any questions, don't hesitate to come and see me. I'm very friendly, I don't bite, and would love to explain my role further if you would like to hear about it. You can contact me on 46630 if you've got any questions, and email through the hospital, but my name is sue.thomsen, THOMSEN, at waitemata.dhb.gov.nz. Okay, see you guys soon. Bye.
My name's Melanie Sutherland. I'm the allergy nurse specialist here at Waitakere Hospital. I run the Food Challenge service on Rangatira unit, so you'll see me around quite a bit on a Tuesday and Wednesday. I'm happy to answer any questions about children presenting to clinic with allergies. We have a allergy meeting that runs weekly, which is chaired by myself and attended by Caroline Cordes, who is our eczema nurse specialist, and Tammy O'Brien. Can't promise that we'll be able to give you answers, but we'll certainly try. Nice to meet you all. Bye.
Always remember to refuel when you're on the job. You'll get your meal card at the start of the run, as well as your computer logins. The cafeteria here is open until 2:30 on weekdays and until 1:30 on weekends, and until 7 p.m. for dinner on all week round. Food here is excellent.